All right, welcome to this installment. One of these days, I'm going to count how many installments I've had so far with, we are in, I don't even know. So this is Coach's Corner. I've got Dr. Judy on with me. Some of you know Dr. Judy because she wrote a course for us called Health Coaching in a Medical Practice, and many of you have taken her course. But Dr. Judy is also a health coach. She graduated from our program. She's got some insights from over the last few years that she would really love to share with you guys in terms of her own kind of personal experience with the healthcare system and what she's learned and how that's informing her thought process here. So I don't want to give up the ghost here. I don't want to steal your thunder here, Judy. So if you don't mind, go ahead and say hello, do the whatever time you want to spend on your background, and then we'll kind of dive into kind of what's happened for you recently.
Yeah, okay. First of all, can you hear me okay? I defaulted to these things so I don't speak too loudly.
Yeah, we can hear you.
Yeah, thank you. Hi, everybody. Welcome. Thanks, Laura, for having me
You got it.
on again. So I am a physician now, but I started my healthcare career 40 years ago as a nurse and went from nursing. I was a nurse for 20 years in various specialty areas like ICU and emergency and that sort of thing, because that was my thing back then. And I got kind of fed up with nursing after 20 years and went back to university when I was late 30s, did a science degree in health education, because in those days I wanted to be a health educator. So in my personal life, I became a health nut about 35 years ago. So I was a young nurse and working in Bermuda, and there was a bunch of people who were party animals, and I was part of that group. It was the 80s. And there was another group that were triathletes and really fit. And they used to go out on Sunday mornings and run and do triathlons and then get together. And I sort of was sitting there going, oh, I want to be like that. So, and of course, a lot of them crossed over too. So you'd see them in the club the night before and then they'd be doing a marathon the next day. I was never like that, but sort of that's how I kind of became a health nut. So at the same time as I went through medical school and after my degree in health ed and medical school, I was a health nut at the same time. And my personal life, that was sort of, that informed everything that I was doing. So when I finished medicine, excuse me, I'm sorry, it's my throat. This is probably not going to go well. Let me see. Yeah, I am going to pop some gum in because it helps keep things clear. Sorry. I went ahead and did an associate fellowship in integrative medicine at the University of Arizona with Dr. Andrew Weil. And that got me started on an integrative medicine career. So I've always incorporated complementary and alternative therapies into my work as much as I could, but I've always worked in a conventional setting. Okay, if that makes sense. I kind of had a foot in both camps. And then I retired in 2020, just as COVID was gearing up. Moved over here to my house in France and qualified as a health coach, which was kind of like, a natural progression for me because it was what I always wanted to do, really. But it's been difficult for me to work as a health coach here because I'm on a tourist visa. So, I've just been working with PHCI and doing a bunch of my own deep dives. But I had an experience with the healthcare system here in France that was unexpected last January. And I'm a person that's been very healthy and fit all my life, and so was my family. And I'd never spent a night in the hospital as a patient. I'd spent many, many nights as a nurse and many, many nights as a doctor on call. But I'd never spent a night as a patient myself. And I had to have an emergency hysterectomy, more or less. It was something that I got the results of a biopsy, and 3 weeks later, I was on the train to Marseille, and I live in a small town about an hour away, to have a hysterectomy. And I'll just say this about it. I was saying to Laura earlier, it was not a bad experience from a medical standpoint because they were extremely efficient and fast here and covered all the bases and did all that. It was all in French, so that was difficult for me anyway, because I can speak a little French, but I'm nowhere near fluent. It was potentially cancer. So I was really, really, scared. I'm here by myself with my cat. So I didn't want to tell anybody. I didn't want to buy into that diagnosis. I knew it had to be done. So I wanted to just get it done and then deal with getting my health back and getting my gut back and getting my, head back to normal after the anesthetic and that sort of thing after it was done. But when I got there, I was just really surprised that no one it just wasn't personalized at all. I had no say in what was happening. No one asked me what my preferences would be. They didn't even call me Dr. Boyce, which, I mean, that's a little bit of a kind of snooty thing to say maybe, but you expect that from your colleagues. When you go into a hospital, they know you're a doctor, so they kind of ask you, well, this is what we're planning to do. What's your opinion about this? But there was none of that. There was no acknowledgement that I was medical trained at all. They just went about their business
right
loudly in French. So luckily, everything went really well. My biopsies and the pathology at the end was negative, and I got out. But I had a kind of a dream or a premonition as I was coming out of the anesthetic and back in my room afterwards. It was a 5-hour operation, so I was like zonked. Mm-hmm. And I heard a voice, and the voice said to me, well, you're in the funnel now, girl. You're in the vortex, and they're not going to let you go. And I thought, wow, I'm getting out of here, and I'm going to make myself as healthy as I possibly can be, and I'm not going to look back. And that's exactly what's happened. I took care of my own post-op care. I made my own decisions about what instructions I was going to follow and what ones I wasn't going to. I was doing the same thing in the hospital. They gave me too much painkiller. I was opening my tablets, my pills, my capsules, and putting them in these little cups and just deciding how much of each I was going to take, because in my opinion, they were giving me a way too high dose of everything. And I started thinking, at the same time, I was following Dr. Zach Bush, who's a kind of a virtual mentor, he is an oncologist. He's a palliative care specialist, and does sort of his own thing. He's broken away from the system.
Yeah.
But he made the point that cancer is I think he said $500 billion business. And I really felt that when I went for my pre-op. I was sitting there, I was in the 5th largest cancer hospital in France, in Marseille, and it was an absolute factory. All these patients, and there were 5 buildings, all these patients were coming and going, and I was sitting there going, why am I here, number one? And number two, wow, like, look at all these people. What is going on? Mm-hmm. So to cut to the chase, over the past since January, so over the past 9 months or so, I decided that I was going to myself break away from any dependence I have on conventional healthcare, as much as is sensible, right? So I've had a couple of experiences since when I actually needed a prescription for something, and I was really glad to be able to get it, so had to humbly ask for a prescription for a UTI for that sort of thing. But I've decided that I think one of the best ways I can be helpful to the patients that I coach as a health coach will be to help them have the confidence to take care of their own health. And if they need me to help walk them through, now bear in mind, it won't be medical advice. I can't do that. So there'll always probably be a family doc or a healthcare provider in their life that they'll have questions and they'll go to see. But I think there'll be people that'll want to move away from that system now, because like all of our institutions, I don't think I'm alone in thinking this, they seem to be getting very authoritarian and a bit pushy and a bit profit driven. And it's just, when you're in the midst of it as a patient, you really feel that now. So I think people are going to want to move in that direction. Not everybody, but there'll be a large group of people that will want help with that. And I think health coaches are going to be well placed to assist with that.
Agreed. So I would love, would you So we were talking before we hit record or before we ever even entered in here. I mean, you've always understood to a certain degree from a professional point of view and your role in integrate. There's a reason why you went integrative medicine. So you did understand some of the shortcomings of conventional medicine as a practitioner. But having truly experienced not just a situation of having to go get checkups and the occasional antibiotic or whatever, but truly experience this from the role of a patient. What do you think was the most surprising to you? And some of this might be that you as a practitioner approached every patient as an individual, you personally, but seeing broadly speaking as an industry and hospitals that it's not that way at all. I'm putting words in your mouth and I don't mean to, but I would love for you to speak to that a little bit. A difference in how you now view the challenges and the shortcomings of the healthcare industry from both sides now as a practitioner, but now as a patient that really needed care and you had your surgery, you didn't get, it's not care, right?
No.
It's a different
information. Yeah, I think the answer to your question and the thing that pops into my head when you ask that question is information. You know, if I sitting in my room wondering what was going to happen next or when I'd next see a nurse so I could ask them questions about what was going on with me or whatever. And I had roommates that spoke English, luckily, so they did a lot of translating for me. It was the lack of information about what was happening, about, you know, you got reams and reams of paper with instructions on them. They're very good with that here, but not like what's going on with me now, you know, and here's what I'm feeling and experiencing. Is that okay? And, you know, that sort of thing. Because when you're a physician or a nurse or somebody on that side, and I'm sure a lot of you can relate to this, if you've done some training or you've done medical care, it's different when you're the patient. And all of that sort of goes away and it's scary. And you want to know what's going on. And especially if you're trained, you want to know what's going on because you want to have, you're maybe a little bossy, and you want to have some say in what's going to happen to your body. And so if I've been thinking about this since we talked last, if a health coach had been one of the people that came through the door of my room and sat down in a chair next to me and said, how are you doing? What can I help you with? Are you okay? Oh, it would have been so great just to be able to say, listen, I'm not sure about this or that. And the doctor said such and such, and I haven't seen her since right after the surgery. And now, luckily, the resident physician that was looking after me, he spoke English and he wanted to know about Canada, and I'm Canadian. So he wanted to know about Canada because he wanted to go and see Canada and maybe work there someday. So he was very attentive. And he was literally going out telling the nurses to look, her IV can come out, or, you know, come and check this, or whatever it was, right? But if there had been someone to bridge that gap, I get chills just thinking about it. If there'd been someone there to bridge that gap, it would have made all the difference. And so for you out there watching, thinking maybe you already do work in a medical setting, or thinking you might want to go and work in a medical setting, and what would your role be? It is hugely about information. It's hugely about education. It's about helping the patients to navigate the healthcare system because it's scary and it's big and it's foreign to a lot of them. And then on top of that, you know, it's the motivation and the lifestyle change and the fantastic coaching that you do. That's also like super important. I mean, that's gravy. But what they see as the role of health coaches is taking the time to give the patients the information and the education that they don't have time or take time or have the education themselves about how to do it, right? So does that answer your question? Long-winded.
It does. And so, you know, here's what I want people to kind of think through in terms of health coaching in a medical practice or in just the healthcare industry. There are so many, literally we're needed everywhere. It's where we think we can move the needle the fastest. Clearly something like a functional medicine practice is going to be the kind of the lower hanging fruit, some sort of telemedicine, you know, situation that, you know, organizations like Simplex Health and Vertex Health and that kind of stuff that understand that what that what patients really need is intervention in their nutrition and lifestyle. But what I find really interesting, what was the old adage? Doctors make the worst patients.
Yeah.
Right? That's the old adage, because the doctor knows what's going on. The average patient is sort of cowered into feeling scared and abdicating the care to a healthcare, so they don't ask any questions.
Doctors make the worst patients because they don't pay any attention to what they're told to do. That's what that actually means. They just do their own thing.
They do their own thing. Okay. So whereas the average patient who is not already a clinical practitioner, they don't have the confidence and the knowledge and the education to sort of push forward and advocate for themselves. And you talked about how you left the hospital and you were able to kind of make your own post-op care. You were able to make your own decisions. The average health consumer does not. They're given their walking orders, their marching orders, which is pages and reams of information that they may or may not know what to make heads or tails of. They kind of zero in on how often do I need to take these pills, and the rest kind of goes out the window. I know what my mom spent over a month in 3 different hospitals for her condition. First of all, the food was crap, so I kept bringing in food to her. But
I don't think we can change that as health coaches.
No, we can't.
It's really true.
But what she lacked, and the good news is she had me and she had my sister to be an advocate for her. She's already vulnerable. She feels like garbage. She's cranky as hell. She's not a good patient either. She mistakes everything that they tell her because she's hard of hearing and like just mentally not with it. My mom is on borderline Alzheimer's. So we had to advocate for her, and most patients, not all patients have that, right? No. So what a phenomenal role in sort of the larger, broader healthcare system to have. This used to be like when my mom used to be a candy striper, right? Where I don't even think they have those anymore, but these were people that just went room to room. They were comfort. Right? They were care, and health coaches can certainly play that role, but really it's more the understanding is here's what's going on. What questions do I have? What do you need from us right now so that they can act as the quarterback of care? I don't think health coaches should be out running to go get water. That's not it. It's what do you need right now to feel comfortable and secure and confidence? Because one of the things we address in your course, health outcomes, they're looking to cost of care needs to come down. I'm calling BS on that from an industry perspective, only because cancer is a $500 billion industry. Are they really looking to bring that down? Not they can't, hospitals and doctors are, and the health
that's an interesting observation.
Are.
Yeah.
But it's different, right? So thinking in terms of all of
they won't admit that they don't want to bring it down, but we can see that on the grand scheme of things, and this is another conversation for another day, but the food system, the medications, the whole drug industry is making people sicker, and they're benefiting from it. So I think everybody here knows that.
I want to jump in here. So Beth is asking a question. It sounds like she's saying that health coaches should help with information that is beyond the scope of health coaching. What type of info is within the scope that she thinks we can do?
Okay. So, I'm sorry that came across that way exactly. There is a fairly specific role if you're working in a hospital situation like where I was. From the research that I did for the course, health coaches are on a team, and the team consists of not always a physician, at the head of the table or anything. It's very often a nurse manager or someone like that. Maybe you have them in the States, a physician's assistant or someone like that. And then there will be a nurse, there will be a dietitian, maybe there will be various nurse managers. And then a health coach is also there. And so your place is at the table, and your role in terms of how much information you give or get from the patient is in whatever, it's not so much wherever you're comfortable, but I think some hospitals have very set information that they want you to be able to discuss. with
Right.
patients, and it wouldn't be anything out of your scope. We'll leave it at that. It would be something that you'd be comfortable with, you'd be trained to do. Does that
Right.
Does
Right.
that
And
make sense?
so I would imagine, so what we're seeing too are health coaches that have a defined specialty within the healthcare system. Like I'm seeing this pop up a lot in terms of jobs, in terms of oncology is one area. So you would have a defined role. You would be trained on the education and information. And really our role as health coaches is more as translator.
That's exactly right.
Okay, the
You hear
doctor
from the patient, what's going on with them, what they're concerned about, how they've been doing, what they've been successful at, and you're taking notes and you take it down, you go back to the team and you tell them what the patient said.
Yeah, it's about checking for understanding and checking for confidence and their own ability to leave that hospital and continue their own self-care. That's kind of that's the way I would view that role. But you're right, it's out of scope for us to say, hey, you've been diagnosed with this. And here's what you need to know without any guidance from a medical professional.
You'll have guidance.
Yeah. But really, a great analogy would be kind of a translator, but then also in terms of like understanding what that post-op care is. Also, some of this is just living day to day and how they're going to go home and manage this care and have them troubleshoot that kind of
Listening.
stuff. Idea is
the
to
whole
allow
active listening and all of that, and picking up what kind of problems that the patient is having. You document them, you interpret because of your expertise where the patient's coming from, you draw them out, you get all the information you need, you document it, and then it goes into the patient chart, which is these days electronic medical record. Everybody can see the results of your visit with the patient, or you go back to the team meeting and tell them what happened with the patient, and then the problems are farmed out to whatever specialty area the people around the table have.
Right.
So I hope that helps answer your question, because the jobs for health coaches in big healthcare systems, like country-wide healthcare systems, are many and varied. You may be an independent working at home online with your clients and just doing the health coaching programs that you've designed for yourself, that you feel comfortable with, that you're trained to do, and you liaise with a physician, and maybe his office nurse or whatever, but you're always doing what's within your scope and what you're comfortable with, or you don't do it.
Exactly.
Right, Lauren? I mean, would you say, Lauren?
So Beth, if you have a follow-up question or you want some further clarity, please let us know. Sarah's just sharing an anecdote. I haven't needed a GP since I became a health coach. I still have my OB and dermatologist, especially since I can order labs. She's a
perfect.
Yeah,
that's the idea.
So great. Yeah, last time I had a UTI, I was negotiating which antibiotics I wanted. So Sarah's talking about how being further educated allows you to advocate for yourself, right? The more we can educate our clients about what antibiotics do, the good and the bad, you can advocate for yourself. Beth is saying that helps. We have another question from Linda. So how do you break through the barrier that health coaches may not align with what the hospital or doctor thinks the lifestyle change should be, primal versus food pyramid? So I have some thoughts, but I know you do too. So you go ahead and start with that.
Yeah, so we addressed that. I don't know if you're taking the course. Is that I don't know the name of the person. Linda? Did you say
Linda? Yeah.
Linda.
I'm not sure if she's there either, but it's okay.
Yeah, we addressed that issue in the chapter on, program planning in the course, because you're absolutely right. That's a big issue. So just run the question by me again so I can be specific about. So
how do you overcome the barrier of working within like a hospital or a doctor when your view might not align with theirs? Meaning,
okay, so it's the view, yeah, because there's a lot in there. I think I kind of jumbled up. Excuse me. So what we talked about when we were writing this is that we're all primal health coaches here, I think, are we not? Right. So we have the whole primal ancestral bent. That's how we coach people. And a lot of sort of doctors, for example, or healthcare providers you'll work with will be plant-based, or they'll think vegan's a good idea, just for example. So they're different than your philosophy. they're so bent on evidence. Okay.
Right.
The whole healthcare system is all about evidence-based. And if anything happens with anything vaguely legal, they have to make sure that everybody in the practice is doing evidence-based medicine.
Mhm.
So we went back to the government guidelines for diet, exercise, sleep, stress reduction, you name it, all the things that we coach around the lifestyle changes. And painstakingly, and I can attest to this, just painstakingly looked at all these government guidelines, and I'm sitting there going, oh my God, these are just so bogus. And, but they're so broad and they're so vague. We'll take the US dietary guidelines, for example, make sure the patient eats 3 meals a day, make sure that there's a good balance between protein and carbohydrates and fats, but they don't say which fats, for example, they might say stay well hydrated or something. So you have a lot of scope within that. So as long as you're paying attention to the guidelines and you document, discuss the US dietary guidelines with the patient, and then you go full primal with them, right? If that's what the patient wants.
Right.
And if you're always going to ask them what their preferences are, and culturally what they like to eat or what they want to eat or what they feel like will heal them, and go from there. But the barriers aren't as great as you think they are, because if you look at those evidence-based guidelines, they're pretty vague, and you can work with those. You can work with them.
You can. And I have yet to ever have a doctor argue with me when I say what I advocate for, what I'm coaching my clients around is an omnivorous, nutrient-dense whole food diet. They're like, oh, that sounds good. So here's the thing. Here's where you likely run into pushback. So I've been doing some work. Some of you are probably familiar with Simplex Health. It's they are a organization that has both a clinical side and a wellness side. And we've got some interns, some primal health coaches that were accepted into an internship. By the way, they're going to be opening that up again. I have to get the link out. They're going to bring on 3 more interns. They are very much aligned with our point of view, this whole food, lower carb. Really their wheelhouse is insulin resistance. Okay. So they're actually looking for our coaches, and there's, I think, more and more practitioners. I think you'd be surprised how much it's when you, but even David, the CEO of that company, said when they approach doctors, they can't use terms like keto or a ketogenic diet. It's like a trigger word. He said he also gets pushback when they use low carb. I'm like, really? He said, yeah, I think because people have tried to, from a dietetics and nutritional point of view, carbohydrates are a whole macronutrient. It's heresy to say we should, so the term they use is a low insulin, high fiber diet.
Oh.
Dr. Robert Lustig is a contributing physician on that program, and he talks about that all the time. He talks about protecting the insulin, feeding the gut. Yeah. So this low insulin approach, and many doctors that they do get. So I think it's about finding a way to describe your philosophy in a way that, broadly speaking, is widely accepted. And the other side to this, Linda, too, is just like not every person that crossed your path is going to be a client of yours. Not every doctor or clinical practice is going to be a good fit for you either. It's finding the right ones that really understand this. Now, if you are going to market as a keto coach or as a carnivore coach, you got to be very specific about who you are going to be seeking to align yourself with, and view this as you're interviewing these doctors as much as they're interviewing you in terms of a good fit for you. Because you don't want to be butting heads. Dwayne is saying doctors do not study nutrition. My GP needs a health coach. It's very true. I bring on in my own private practice fitness people, other health coaches that have graduated from other schools that didn't teach nutrition science, the number of schools that don't teach it at all. And I've got these women that are now coming to me that are like, I don't understand what's wrong. I'm eating clean. I'm like, what does that even mean?
What does that mean?
Yeah. So, there are a lot of people that are practicing in this space that haven't had the melding of these two worlds like we've done here. The melding of sort of the evidence-based sciencey stuff, and also sort of the coaching and all this other stuff. So there's some synergy there. Sarah is saying 40% of my caseload is nurses, no joke. Absolutely.
Yeah.
Think
I
about
think
the
that.
stress that many of these nurses are under, the food that they have access to at the hospital if they're not already packing their lunch.
Shift
And
work.
again, just sort of who is funding their ongoing. Nurses need CEUs too, just like RDs and doctors, and think through who's actually funding their education. When I was in the hospital having my 2 girls, I was appalled at my food choices. I just didn't eat. I had my husband bring me food. But most of the nurses that worked with me, many of them were metabolically unwell. I could tell just by looking at them.
Oh, yeah.
Yeah. Oh my gosh, it's terrible. Angela is saying I'm an ACE certified health coach, posture alignment specialist. Very nice. 200 yoga hours. I worked in a chiropractic office and used some health coaching to help gently guide the patients with restorative exercises. I love that. Education and basic lifestyle connections and pain in the body. So my interest is in helping clients with chronic pain whose only options are pain medications. So connecting with doctors for chronic pain, stress, patients. Yeah, so you can go into, I would love for you to explain this. Like if you're going in with more of a niche in mind, you don't have to go in and pitch, here's what I teach. It's here's the problem I solve. Go ahead.
Right. Well, this, Angela, hi, Angela. Pain clinics are one of the places where health coaches are actually being brought in. Cancer clinics, pain clinics, menopause clinics, and the integrative and functional and chiropractic.
Yeah.
So most of these, I would say most of these forward-thinking types of practices already have health coaches working with them or are wanting to bring health coaches in. So I think you're asking about where would you start looking for work if this is your niche and these are the patients you want to work with. Just you could go, you could become a pain specialist yourself with the knowledge that you have in coaching chronic pain patients. If you wanted to work in a clinic, just Google and find the pain clinics, because they're usually called, New York Pain Clinic or whatever pain clinic, or most hospitals, if they have an anesthetic department, they do surgery, they have a pain clinic, because it's the anesthetists, as you know, that take care of the pain patients. So that's how you'd find them. I want to just go back for a second to the Dean, who said that his doctor needs, Dwayne, yes, hi Dwayne, his doctor needs a health coach. You're so right there. I just wanted to just say there that one of the things that we kind of recommend in the chapter that's about going out and marketing yourself to practices is that you offer the physician, the lead physician, the person who's saying yay or nay on whether or not you get hired, offer them a coaching session or a mini package so they can see what you do. Because you're absolutely right. They have no idea what health coaches do. They like the idea of it, maybe, or not, but they don't know exactly what health coaches do.
Yeah.
So it would be a good idea.
I love that. Yeah. So she's saying, so connecting with doctors. So the question, I guess I have for you, Angela, too, is do you have an interest in being hired and working in a pain clinic, or are you interested in more of a referral-based business where you're collaborating with those practitioners? And where you're able to actually speak that clinician's language, which we teach you in the course. We teach you a lot about kind of clinical language and the difference in working with patients, somebody else's patients versus your own clients. They're different. But just putting yourself in the mindset of what the challenges of that end patient is that's dealing with this chronic pain. A lot of this, talk about the psychology of being in chronic pain and this feeling of helplessness and this lack of confidence, and that this feeling of again, just helplessness and this reliance on medication versus your background here with a movement specialist and yoga. There's a lot of mindset work built into this stuff that, you may have patients here that are on medications for now, so it can clear away some of the pain that then allows them to move in ways that can help reduce pace over time. It might sort of clear the decks a bit here to open their mind to making other changes once you kind of get a feel for what the mechanism of action for that pain really is.
Yeah, and the fact that you're going to sit with these people and really hear what they have to say, and with your active listening and your compassionate inquiry, and maybe you'll hear about that their pain is actually being triggered by an unhealthy relationship or problems they're having in their family, or past issues in their in their life,
Mhm.
trauma and that sort of thing. And you'll be able to get these tidbits of information. I'm just going to mute for a second while I have a little cough.
No problem. So Angela's saying, yes, thanks. I feel your course would help with the clinic as a like a consultant. Absolutely. They need to know how the chronic pain cycle works. You're exactly right. So, and that's what you come in as, and you present yourself to, especially as, so whether it's pain clinics or any kind of, it's being clear about what it is you feel you can, what you are an expert in. We talk about this in the main certification in our business model, where we're asking health coaches to think back, first of all, everything they learned with us, assuming you're a graduate of our course. If you're not, that's fine. But everything that you've learned through your education, certifications, what have you, but then also everything that you bring to the table, your past experience, any other education, things that you've discovered on your own, and you're able to wrap that all up into a deliverable that has value to someone. Mm-hmm. So then how can you take that deliverable that you've built and make it integratable to a practice, if that's what you want to do, or how can you turn around and communicate and sell it to a practitioner and about how you would be an allied consultant to that organization? So that's kind of the way I view this. But, you know, Judy, so given your experience kind of in the healthcare and medical system in this, like, so you have this renewed passion now of just keeping people out of the sick care system entirely, right? And that this is really the role you think health coaches.
I think it's the way of the future, personally. I think there may be a different system being developed as the world changes in response to all the authoritarianism we're seeing being pushed on us now. I think there will be some changes. I don't know what they're going to look like, but I think the healthcare system, maybe that healthcare system won't change, because they're always going to want to make money the way they make money. But I think the way that people look after themselves and the people that they seek to help them if they need help. Personally, I think going back to nature, and the ancestral approach, how the human genome was designed to thrive, can't go wrong. So there will be times, like the example of the UTI. I mean, I was hiking in Scotland for 6 days, and I was out in the middle of nowhere, and I needed a prescription. So I was on the phone to the NHS, and as I can't remember your name, but as you said, I was telling Sarah. That was it. Sarah. I was said, this is what I want. I'm a doctor. This is what I want. I want it for 3 days, and 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 guess what? They gave it to me, and because I'm Canadian, they gave it to me for free. But it took me 5 days to get it, and I was very grateful for the healthcare system when I got it, because I immediately started to get better. And I got this cold 4 or 5 days ago, and I was all congested, and and I went to the pharmacy and I got decongestants, and I don't want to take medications, but I could breathe. So it humbles you a little bit. You think, well, I guess I can't do this 100%, but personally, and we all have to do what our inner wisdom tells us is best for us. So getting back to nature, being authentically you, not listening to others, because trust me, I was well indoctrinated into the system, all through my entire life, with parents that were very, don't rock the boat, follow the rules. And then school, and then university, and nursing, and medicine. And I was always looking to other people to make sure that I had all the guidelines and I was doing everything according to regulations. And now I can see that maybe for me, I should do what my inner wisdom tells me to do. And I think that's what we have to encourage our patients to access their inner wisdom and trust it. And that's, and help them decide what's best for them, and not what their husband says, or what their kids say, or what their sister says, or what their doctor says, or what the government says. So this is where I'm going with my health coaching now. When I finally get back I'm going back to Bermuda to locum for a couple of years, because I was invited to go back. It's a good move for me, because I wanted to leave France anyway, and I want to get back to North America. I didn't necessarily think I was going to go back into conventional practice again, but it's okay. I'll be making money, and and I'm going to approach it. So I'm in the same boat as you guys right
Yeah.
now. I'm going to approach it because it makes me, but it's the patients. It's about the patients, and the patients need us really badly.
Right.
So I'm going to approach it as a big learning experience. And it's just for a couple of years for me. And then I'm going to be doing my own thing with helping people.
Yeah. Yeah. An opportunity to go back into medicine temporarily,
Helping to
this new mindset, this new experience and new skills, and then make the difference you're looking to make for that short-term period, and then get back out to kind of working more. And look, we use the term like avoid the sick care system. We can't use that language when we're approaching healthcare practitioners.
No, not at all. You have
Okay, so you can't use that language, but what you can do is speak to practitioners when they think about literally the thousands of patients that are in their practice, especially if it's a larger sort of group practice. Holy cow. And taking a look at what percentage of that are being treated for chronic metabolic illness. If you can just use population statistics as a guide, 80% of them or more, right? And what percentage of them have been able to actually improve or move the needle to either lowering or removing medications? Almost none of them,
Probably
right?
none.
So would it be helpful
if they're not getting counseled around that?
They're not. Exactly. So, but if you can go in, if you can get the ear, it's having a conversation about using you as sort of an allied resource for those clients that have. So it's either coming in, pitching yourself in a position that's going to be harder to do if they don't already have a position available, right? You're telling them, hey, hire me.
Yeah. You need me.
Yeah. You're going to have a better, I think, approach if it's for those clients that have HSA accounts that will pay for health coaching, or if you have patients that have the financial flexibility to pay out of pocket in order to say, okay, my doctor diagnosed me with this. I'm on these medications. This health coach understands this landscape. She's not diagnosing me. She's not treating me, or he, sorry, Dwayne. But it's this health coach is now going to help restore me back to wellness. Help me improve my situation by controlling what's controllable with my environment. Doctors will get that. And they, trust me, doctors are now overworked. They're overworked with patients that have clinical and chronic conditions that are not
getting better.
No, they're not getting better. They would love to get back to working with patients that really need them in the moment, rather than this client that just keeps getting worse and they just keep upping their metformin or their insulin dose. So Dwayne has a question here. I'm with a company that has a supplement, which is out of this world. Awesome. It's a business and it's a business I am responsible for growing. Would I be able to offer it to my clients if I decide to take the health coach course? So it sounds like Dwayne might not be like a graduate of our program. Yeah, I mean, so look, as long as the supplement is available over the counter to any health consumer, I don't see why you wouldn't be able to offer it. Where I'd be careful, and Dr. Judy can weigh in here, is be careful about your language. Be careful about seeming to like prescribe something. It can be something where you, from an education and information point of view, helping to understand what that supplement is, what it actually does, and how it may be relevant to what they're experiencing. I don't know. Do you have some thoughts there, Judy?
Yep. Yeah, you'll have to be, it depends on who you're working with, whether you're working 100% on your own, or whether you're actually working in conjunction with a practice or a physician. Because if you're looking after someone's patients, a physician's patients, you will have to sort of sit down with that physician and say, look, I work for this company and this supplement is awesome. And it's been tested and it's, safe and effective, or whatever you want to say about it. But a lot of supplements or components of supplements, various herbs or amino acids or whatever, are contraindicated with particular medications. So the physician will have to know what it is you're recommending. Unless you're 100% independent, then you can do what you want. I mean, as long as it's out there and it's on the market. And Right.
So no, if you are looking for physician referrals, let's say, into an independent business, make sure you understand how that supplement might be contraindicated to certain medications that physicians may be sending you.
Yeah, I think you might not be able to get that information unless you check with a pharmacist, because they know, because they have these huge databases where they check these things, or just check with a physician, because at the end of the day, the physician is responsible for that patient. And if something happens and the patient has a reaction, say, for example, then it falls on the physician's shoulders, but
Hmm.
the whole team gets dragged into it
Right.
legally. So you'll need to just be honest and say, this is what I
Right.
believe, and I use it myself, and I recommend it. Are you okay with it?
Yeah. Yeah.
So if you're working with somebody integrative or functional, and they're used to working with supplements, they're going to probably be fine with it. But if you get somebody really conventional, you may have to do some educating.
Right.
Yeah.
I remember when I was pregnant with my twins, and I was using a magnesium supplement. My doctor wanted to run some blood tests to make sure I wasn't overdosing on magnesium. I'm like, trust me, I'd know. I would be in the bathroom like all day long if I was ODing on magnesium. And here's how, but to your point, very conventional. She's the doctor that delivered my first two babies. I had since become a health coach in the time frame between when my youngest of the first two was born. In that time frame, I became a health coach, and now I'm pregnant with two, and I felt very comfortable continuing to take a little bit of it. It wasn't anything crazy, but it was just funny. But she was very like, let's just make sure. So, okay, I agree. Let's see. We've got, that's why we work directly with clients. The supplement is made in our mitochondria. So
love mitochondria.
Yes, go mitochondria.
Hey.
Okay, so Kai had a question here. Kai Van Bodie, is there a framework for teaching patients to listen to their inner body wisdom?
Is there a
framework? Is there a framework for teaching patients to listen to their inner body wisdom? How would you just explain that?
Right. Okay. This is a little bit of stuff I'm doing myself. It's one of the rabbit holes that I've dumped down over the past 3 years since I sort of came over here to France and wasn't able to work at health coaching. So I've been doing tons of education. So yes and no. I mean, it's about energy medicine, right? So it's energy work. It's about connecting with source. It's about connecting with source, the universe, God, whatever you want to call it. That's yourself, who you are. So there isn't so much of a framework as a recommendation just to get quiet. So there's meditation.
Yeah.
The yogi, and I'm sure there's lots of yogis in the group. When you're working on the mat, you're very focused on what's happening in the various parts of your body that you're working on. So it takes you within. So, you can do mindfulness meditation. Deepak Chopra is great. Just start to do your own work. Personally, I did sort of my human design and my astrological signs, and I got all into that. So, because I believe in the cosmic energy and everything, a little bit woo, okay. But I think that we're at a time in history where people are looking for that and open to that. And for me, in my life, I want to be more authentically me. And I left nursing 30 years ago because I was sick and tired of being told what to do by doctors, taking orders, right?
Yeah.
And then I went into a career where you're just taking orders from regulatory bodies and government and other doctors, and it was just as bad. So I'm just at a place now, at my great age, where I really just want to be authentically me. So that's a pretty vague answer to your question, but it depends on where you're at with it yourself and how you want to approach it. And then, put it out there. And I think it'll come to you. There's lots and lots of, consciousness. Anything that has to do with consciousness is going to be about accessing your inner wisdom.
Yeah.
Get quiet. Just get quiet and listen for what comes up. And remember, your suspicion is your intuition. So if you have a suspicion about something, like with a patient, you're with a client or a patient, and you think, this person's being abused at home. It'll just come to you. A thought will come to you. Why did I think that? And then sort of maybe you want to go into some questioning around what's going on at home or something. That's listening to your inner wisdom. It's trusting it, it's hearing it, recognizing, okay, I've had this suspicion. And I'm going to follow that lead,
Yep. if something keeps coming up, you got to start listening to it. And a couple, so I love what you said too. It depends on sort of where you are in your level of comfort with this level of woo in terms of just like listening to that inner body. I'm sorry. Feel free to cough away. I know you're muted. It's completely fine. I'm just going to give my 2 cents here. So, you know, when I had gotten sick, I was very kind of conventional evidence-based as well, because I wasn't in this industry at all. I was a data girl. I was in finance, right? I was a very numbers, everything's got to be logical kind of person. And it wasn't until the only practitioner that helped me he was a chiropractor by nature, which I'd been to chiropractors before. I understood the benefit of an adjustment and all that other stuff, but then he took out the needles and it was acupuncture. And boy, I have to admit, the first session, I didn't really notice much of a difference because I was so stinking terrified about, I mean, I just knew I had needles like in my face, you know, in the different meridian points around my body. And I just didn't get it. And I finally took just, I guess, a level of comfort of having to participate in that a couple of times that I started to take that time. I'm like, look, the time is going to pass anyway, rather than sitting here running through my grocery list in my head while there's needles stuck in my face. Why don't I actually start paying attention to how my face actually feels and paying attention to where these needles are and see if I can actually, and that's when finally I could feel the energy working through those needles, but it took me some time. And that's when I finally started to be like, all right, maybe there's something to this meditation stuff, you know, and because my stress levels were so high and I got into just, I'm still bad at it. But any time that I can spend just being very present in the moment, even if it's only for 2 minutes, is better than 0. And then, so now I've kind of bought into meditation, and then I moved into breathing and breath work. I think Angela mentioned something about guided relaxation on the body. Very helpful. She's so right. And I use this with my girls. My littlest one she's just afraid to sleep alone. Long story. She had some idiot friend of hers who told her some horror story. Now she can't sleep by herself. So trying to fall asleep is really scary for her. So we do this guided relaxation on the body together where we're relaxing her head. And the next thing I know, she's snoozing, you know? So all of this stuff really works. But to your point, Dr. Judith, it's being trying to gauge, I think, where your client is on the woo spectrum, just how comfortable they feel, and start with some that likely has maybe some clinical efficacy, like so some of these things.
Mindfulness.
Yeah, mindfulness is a big one. Meditation, tons and tons of research on it. Breath work, tons and tons of research on it. And, you know, it can make a big difference. So find a framework that works for you, that you can do with every client, get to know it really well. So Neil is saying, I'm in a working relationship with my general GP where he's referring some of his patients to me. Yay! I specialize working with diabetics, insulin resistance, etc. He has referred me 6 or 7 patients to me so far. That's awesome. But none of them have taken the initiative to contact me. Okay. What is your suggestion on getting these patients to contact me? My doctor is thinking that maybe if I see his patients at his clinic, that would help. What do you think?
Okay. So I was reading that while we were chatting as well. Neil, I think it's awesome. Congratulations. This is good. It's a good start. It sounds like you are working from home or working virtually, and the patients haven't contacted you. And it sounds to me like maybe, I don't know how he's delivering your information to them, or whether he's saying that, you know, here's a phone number, or it sounds to me like they don't understand the benefits that they could get from working with you. He just hasn't communicated that to them. So you could email him and let him know that, you know, hey, you know, I'd love to see these people and they haven't contacted me. You could contact someone in the office that might be sort of a nurse, or if there's a diabetic nurse in the office, because there often is. I mean, she might be a little bit more amenable to chatting with you about it, and maybe she would liaise with you. And yes, I 100% think that if you were in the office and the patients were right there, that would be huge, because if you sit down with them and they realize, hey, he's actually going to listen to me when I talk, and he's, you know, responding and he's asking me questions, they're going to want to come and see you. Yeah, I think maybe okay, I see what you've said here about the testimonials and the brochures and things. Sounds like they need a little bit more.
Yeah, what was going through my head was potentially Would he be open to doing a joint email introduction where you now have this client's contact information, as long as you promise not to spam them, right?
Or a group. What about a group?
Yeah, absolutely.
You could give a talk. Give a talk to a group.
That was on my list. Offer to do a group talk to this list of patients that fall in your wheelhouse, a free talk that speaks with that, and don't be afraid to give away actionable information. Don't be afraid to give that away. The other thing to consider is not that you need to live, if you're in his office, I do think that would help. I agree with you, Dr. Judith. But if you don't want to necessarily be in his office 24/7, but you're willing to have office hours at his office where patients can sign up, and even if they're not willing to engage in a longer term program, would they be willing to do some kind of like, again, open office hours where they just pay you for your time and they kind of come in. But I think a group talk around a specific topic that's uniquely relevant to this particular audience they need familiarity with you. Most of these patients have no idea what health coaching is. Insurance doesn't pay for it, but you can take a look, do a little bit of research into which insurance plans have an HSA or FSA that actually will allow them to use that, and make sure your doctor knows that and might be able to help you with that as well. So familiarity, I think, will breed a lot of this. We're talking about afternoon hours on Wednesdays and Thursdays. Yeah. Awesome. So Sierra, I work in a doctor's office, and I definitely think it helps with the patients coming to see you being in the doctor's office. The doctor also offers his patients one free visit with me. The doctor pays for hourly, and then I get a bonus commissions for returning patients. So we're starting to see this as a model now, guys.
Yeah.
We're starting to see more and more practitioners willing to hire on a health coach, again, paid either hourly or contract, or maybe there's some sort of base pay where you are then compensated for more visits and more. So you both have skin in the game, basically, both you, the doctor, and I love that setup, Sierra. And that's an example of some stuff we're seeing. So thank you for sharing that.
Yeah. Awesome.
I love
baby steps. We're getting there one step at a time. Just get our way in there.
We are. And look, like organizations like Simplex will continue to grow. Verta Health is on everybody's radar these days, I think. Iora Health is another one. Health share plans, many of them offer health coaching, and they may actually be hiring. Insurance companies are. I would take a look too at LinkedIn and follow certain doctors that might have profiles on there that actually post research or opinions on whatever, especially if it's kind of in your wheelhouse, and message those people. There's more and more opportunities.
And the direct GPs now, that the physicians, the general practitioners, direct primary care, they're called.
Yep.
Direct primary care in the US. A lot of those direct primary care docs have health coaches that work with them, and they're online. They're 100% online.
Yep. And I'm seeing, every time I'm on LinkedIn, I'm seeing tons and tons of positions for hourly roles that are, I don't know, $30 an hour. So if you're doing that full time, that's like 60 grand. If you're doing that part time, you're looking at $30,000 to get some skin in the game here, where you continue to grow while you're building your other business if you want to. So there's lots of legitimate. Look, also, I learned a lesson too from someone who wrote me. There are some people that are out there scamming. So people that are posting as though they have a position available, they are pretty convincing, they think they've got you on the line, and then all of a sudden the big hook is, oh, but you have to buy your own equipment, and you have to buy the equipment through their supplier. Red flag. It's different if it's go ahead and buy your own laptop and send us the receipt, and you're buying it at Best Buy. I mean, that's a little, but so just be mindful of that kind of stuff. But I do find LinkedIn to be a little bit better in terms of their firewalls. People have to really, and legitimate employers. But I think we covered so much. So for those of you that are not a graduate of our course, feel free to reach out to me to have some questions about that. Those of you that haven't taken health coaching in a medical practice, but you really think you want to either get a job working in a medical practice and you really want to understand how to communicate, or you want to work collaboratively and want to feel comfortable reaching out to physicians, or other medical clinical practitioners, let me know. One thing we're working on, I don't know if I was telling you this, Dr. Judith, but we're working on helping to curate a path that would allow you to, and So curate an educational path and producing a separate certificate. But think about the power of the primary course and master coach, health coaching in a medical practice, functional therapeutic diets, human intestinal microbiome. So it's 5 courses. What a phenomenal package to go forward and call yourself a functional medicine health coach. Okay, you're not practicing medicine, you're a health coach, right? But everything you learned is squarely in that field. You can use whatever term you want. We all know there's no regulatory body, but it's just a phenomenal sort of curated basket of education that is usable whether you have your own independent practice. But adding that master coach and adding that health coaching in a medical practice will make you a more desirable candidate. And when you see positions listed online that says, oh, we want you to have a degree in public health or a degree in whatever, unless it says non-negotiable or required, don't worry about it. Make sure you add in what your training is and make it a really phenomenal cover letter about why you think you're a great fit for that. And that's what's going to get a hiring manager's attention, is that cover letter. They want to get to know you a little bit before they dive into that resume. But this was awesome. Is there anything else you kind of want to add here before I let you go?
Me? Or
Yeah.
the group?
No, you.
Okay, I was just thinking that something it's gone out of my head.
Getting late there. Dr. Judith, she walks the talk. She's got her amber
Oh,
glasses.
no, I know. I
her...
wanted to just, yeah, I'm all about circadian.
Yeah.
I'm all about circadian lifestyle now. I'm all about mitochondria. Dwayne, I hear you, Dwayne. Is that, I'm guessing what molecule or what atom or what electron you're focusing on in your with your supplements. But you know, it's nature. Get back to nature. Get back to natural ways to do things, and quantum biology is where it's at. But I wanted to say about the course. The various things in the chat have been questions about stuff that is addressed in the course. We spent a lot of time because you know I was a nurse, then I was a physician, and I had to go through all of the orientations, and you know I know what it's like to be green and to walk into a hospital and go, am I in Mars or where am I? You know, because it's a different culture. So we constructed the course to really make it you ironclad. So when you go in there, you're ready to join the team if that's where you want to work. And we gave you lots and lots of resources for marketing yourself to various practices. So
yeah, so there really are a lot of resources in there. But at the end of the day, guys, you've got to do it. That's some of the things we talk about here at Primal Health Coach Institute. We can give you all the tools in the world and all the resources in the world, but you have to actually take action with it. We say the same thing to our clients, right? Our end clients, we can give them all the education and information and tools and resources in the world, but if they never do anything with it, they're not going to get anywhere. And confidence and skills come with doing it. So it's like, hey, I'm not good at writing emails. I've never done it, or I'm not good at it yet. I'm going to write up an email and I'm going to send it to somebody I trust and ask them to critique it for me. And I'm going to send my first email, or I'm going to go knock on my first door. Not that I'm advocating that you go knock on doors, but you know what I mean? You've got to do it the first time, learn from it, refine it, do it a second time, learn it, refine it, do it a third time. You get better at it the more you do it. And whatever doesn't work informs what you are going to adjust later. But, you know, if we think in terms of getting back to our client's point of view and the things and the skills they're trying to learn, we're all starting here too, especially if we're new to coaching, and have a little bit of grace. I do think healthcare and corporate wellness are the 2 biggest areas we're going to see growth. I just think those 2 areas have recognized the need. That recognition is there now. We're starting to see more positions available, which means there's also a huge subset of the market that might not necessarily be looking for a position, but looking to refer. They're looking to outsource that role because they've recognized the value at it. And if you take this course from the healthcare perspective, it needs us, right, Doc? It needs us so badly. Get out there with confidence and know that you've got a lot to share. We got some last minute things. Are exemptions from vaccination still a possibility after the whole pandemic fiasco?
I think they're a possibility. It depends on the country you're in, and it depends on what they're going to do with the mandates. So I wouldn't be surprised if it got a little more military and authoritarian. But there are some states, that are saying, no, we will not comply, and we're not going to do mandates. So it depends on where you live. Keep, stay positive and stay hopeful.
Right. And that's a great
Crazy
question.
world.
That's a great question, because if you're looking to enter into the healthcare space, a lot of them have that requirement.
Yeah.
That not just COVID-19, but lots of different vaccinations. My daughter is going to school for dental hygienistry, and they require, she's lasted this long without getting it. And she finally got into the program. She'd been waiting 3 years, and they were requiring it.
This is where your inner wisdom comes into play, everybody.
Yeah.
You know?
So anyway, all right, we got to be.
Or are you going to listen to yourself? Okay, don't get me started. All right.
Oh, I know. Yeah.
Okay.
Let's not go down that rabbit hole. That's a whole other webinar.
Yeah.
But thank you, Dr. Judith, for your time and wisdom. And I'm excited that you're on the mend. And I'm excited for this new chapter. Let us know how this is going with you. And, who wouldn't want to go to Bermuda, right? And
I know, really, right?
Work there for a while. But Dr. Judy, I'm sure we'll be doing more with us. We love her. So let us know. But thanks again, Judy, for everything.
Yeah, great. Good luck, everybody. Get out there and make people happy.
That's right. We got it. Bye, everyone.
Bye.